Laminitis is a disease that we've feared, well, ever since humans have worked with horses. It's a consequence of a number of primary common disease processes in the horse. We see it in mares that have retained fetal membranes, horses that eat too much grain, horses that have fevers and GI disease, enterocolitis. There are all sorts of diseases that have an association with laminitis, where it's a sequelae of that other primary disease. But historically, there have probably been a lot of horses, and ponies in particular, that have had unexplained events of laminitis. So it's happened in the middle of the winter, and they've just been owned or been taken care of managementally wise exactly the same way as they have been for the last 4, 5, 6 years, and all of a sudden they're foundered, and nobody could explain why. Or a lot of those rather bigger ponies that foundered when they saw grass in the spring or summer. And we always used to say, well, these are ponies that just can't tolerate the grass. It's spring grass founder, and that's just one of those things that we know sometimes happens to ponies and other breeds of horses. A lot of those are actually EMS cases. So a lot of grass-inspired, pasture-inspired founders actually end up being this particular condition. That doesn't mean it's necessarily, easy to prevent, but in reality there is, unfortunately, a strong association with pasture-associated laminitis in horses and ponies that have this syndrome. Any time, and I would say this to veterinarians as well as to horse owners, anytime you have an unexplained, spontaneous bout of laminitis in a pony or horse, consider the possibility of this syndrome or this particular problem. Unfortunately, we don't have an enormous number of treatments or preventions other than the treatments that we give for laminitis in the first place. But anytime a horse or a pony has sudden, acute onset laminitis, and there doesn't seem to be a very good explanation as to why that's happened, you should consider this particular condition. There is another condition, particularly if it's an older horse, that you must also consider, and that's Cushing's disease. And the two diseases are very close and very difficult to tell apart sometimes, but there are some important differences that I'll talk about on a subsequent slide. Very often, one of the most valuable ways of distinguishing Cushing's disease from equine metabolic syndrome horses is purely the age of the animal when they first have their first bout of laminitis. Many of the EMS horses are much younger than the Cushingoid horses. Cushingoid horses tend to be teenagers, middle, late teens, and older. EMS horses tend to be horses when they have their first episode that are less than 10 years of age when it first happens. Not an age when we really expect that Cushing's disease is going to occur. So, many affected horses are what have historically been referred to as easy keepers. The kind of horse that even when you try and get condition off them, it's very difficult to do it, even if you feel like you're starving them. So they're the sort of horse that doesn't really take much to keep very, very good body condition on them. Some of them are even obese as very young, mature horses. You'll sometimes see this before 5 years of age. Some will be 3, 4, 5 years of age. They may even have been fat as yearlings. That's unfortunately a good giveaway that they're likely to have future problems in later life with their feet. Typically, however, they are between 5 and 15 years at the first onset of clinical laminitis, which is in contrast, as I said, to the age group when most animals have Cushing's disease, because those are much older. Very often, and certainly historically, I know I have missed or misdiagnosed early episodes of laminitis in EMS horses because we've basically ascribed the blame to pasture. We've said this is a grass founder, spring grass, it's a pony, we know those happened, when in actual fact it isn't as simple as the fact that it's gone on grass and foundered. They have this rather broader endocrine metabolic problem. So how can we go about diagnosing it? And what are some of the things that both you as an owner and us as veterinarians can key on to help us? So there are some laboratory tests, and there are some things that veterinarians can run and some testing that can really help confirm it. But by and large, a lot of the cases of EMS, you can have a very strong suspicion that that's what the horse or pony has, based upon the physical exam and the history. So any horse that, and I don't know how well it shows up at the back. Let me try and get the pointer here. Here we go. So any horse that falls in this final column here with a body condition score of over 6, between 7 and 9, that's where the EMS horses tend to be. We don't tend to see them where their body condition score 1, 2, 3, 4, 5, or 6. They're usually 7, 8, 9. Occasionally you'll see one that's 6. So get used to body condition scoring your horses. And again, I have a link at the very end of the talk which gives you a website to go to where you can find all the information you want on body condition scoring on horses so you can learn to do it yourself. It's not something that you need to be a veterinarian to do. So if you have a horse that's foundered and it's body condition 1, 2, or 3, it does not have EMS. They have to be basically fat, 7, 8, 9. Not all of them look fat all over. There are certain parts of the body where horses and ponies with this problem will deposit fat preferentially. Those places are in the middle of the neck, so they're classically described as having cresty necks, rather stallion-like, even if they're not a stallion. So cresty necks in this area here, that's one of the places they'll deposit fat. Around the rump, high up here, just behind the hips, just either side of the tail head and a little bit forward, they'll have big fat deposits there. So if you've got a backside that looks hollowed out from behind, it is not an EMS horse. If, however, you've got a very large backside that raises above the base of the tail head, then that might be a horse that does have that particular problem. So they have to be in that column there, not in the moderate or poor body condition. So they're over-conditioned horses. 7, 8, or 9 body score. The other thing that, even if the horse only has a very subtle history, or the pony, a subtle history of maybe being a little sore-footed once in its life, and now it's had another episode of laminitis, if you're suspicious that your horse may have EMS, or some of the rest of the testing proves to you and your veterinarian that indeed it does, even if they've never had laminitis, I would suggest that you go to the lengths of having radiographs of their feet done. Because very often, either radiographically, certainly radiographically, to the veterinarian's eye, you can see evidence that they have had bouts of laminitis previously. You may not have appreciated, perhaps you haven't always owned the horse or the pony. They may not be uncomfortable at this particular point in time, but it is very useful to have baseline radiographs to which to compare them, because laminitis, I'm not saying it's inevitable with EMS, but it is so common that when they need to have radiographs taken in the future for diagnostic and prognostic reasons, it would be very nice to have something to compare to in terms of the steady normal state that the horse was at basally before it ever developed soreness. There is some blood work and diagnostic testing, which I'll come on into a minute, that your veterinarian can do, but certainly get into the habit of body condition scoring your horses, and as I said, there are numerous online resources that can help you with what a body condition 5, what a body condition 2, what a body condition 9 horse looks like. And even if you don't have a horse with EMS or a pony that you're suspicious of having EMS on your farm or that you own, it's not a bad thing to body condition score horses anyway, is it? So that way you can regulate how they're doing over time and have something to compare to. It helps you with your general preventive medicine program, whether it's deworming or teeth or whatever it might be, particularly as horses get older. Body condition scoring can be something that doesn't require trip from the veterinarian, but it can be something that keys you into there being an issue and a change over the last 6 months or the last year, perhaps soliciting veterinarian attention as a consequence if you do see a change. So, laboratory testing. Because of their metabolic problems, because of the endocrine disorder that they have, there are some things on some blood work that very commonly, not always, but very commonly they have. They often have elevated blood glucose, because they don't deal with glucose normally peripherally within their tissues. It is often, but not always, elevated. They also typically have elevated insulin levels in their bloodstream. Their body is responding to the high glucose levels by pouring out insulin. Unfortunately, the rest of their body doesn't respond to the insulin appropriately by taking up the glucose. That's why the insulin keeps going higher and the blood sugar keeps going higher. They respond to the increased blood sugar levels, but they can't utilize it appropriately.